Hi guys, Dr. Luster here, and we've been talking a little bit about my certifications and techniques and modalities so you understand a little bit. And right now I want to talk to you a little bit about nutrition. So I have a master's in nutrition, and I find it very important because it is actually super significant for pain management and just a lot of overall dealing with systemic issues. So I think that that's fairly obvious for people, but what people don't seem to realize is that it truly impacts chiropractic and also just pain management in general, which is kind of the point of a lot of chiropractic and why people come to see us, right? So nutrition is an incredibly important aspect of this. Now, with that said, I always like to provide the caveat of it's not a one fix fixes all, and it is always a constantly changing type of situation. The things that we can control, we should try and control to some extent, versus the things that we can't control, we at least need to help our system buffer them the best that they can. Now, with that said, I always like to put in the caveat, and there is a video that I have done for your explanation for some of that, that talks about me and my own struggles with weight loss. Despite some of the things that I talk to you about and I definitely practice what I preach, and you can talk to anyone that's around me. I can be kind of difficult because of the things that I practice with nutrition, because it's important. But there are things, just extenuating circumstances sometimes, and it can be very, very frustrating, and I definitely get that. But so when I'm talking to you about nutrition, I'm trying to come at you from this place of, I am not trying to body shame you or tell you like, just lose weight, it'll be better. Like, I hate it when people would tell me that. Like, I hate it when doctors would tell me that, because it wasn't true. If I could lose weight, I would lose weight, but I'm trying to come at you from this position of, we need to change some things that are causing inflammation in your system, because those inflammation, like, yes, it's causing weight gain or, you to have this weight on your system, but more than that, it's causing these domino effects. And so maybe it's not necessarily about losing weight so much as it is about removing a food that is causing this complex problem, so that's more of where I'm coming at you with some of that, because it does provide significant relief. And the other way I talk about this is saying, like, you eat approximately 3 times a day, and so you are putting what your choices with what your choices that you make with that are significant, because you are doing it 3 times a day, every day. And if you are making bad choices, you are insulting your system 3 times a day, every day, and trying to have it respond to that and cope with that. So when we're talking about nutrition, we're really coming at it from that perspective. So I'm going to talk for a second about what systemic inflammation is. So systemic inflammation is this idea that everything in your body is like on this high alert all of the time, and so it can't calm down. So your nerves are super excited, everything is, your heart races more, you're easily anxious, easily work-upable, basically. Maybe it doesn't manifest as anxiety, maybe it manifests as anger or whatever. You don't sleep well, your system can't relax, you have trouble with digestion, all of the things that should be present with rest and digest in your normal situation are not. Instead, you're always just ready to fight this bear, right? With that idea, when we talk about systemic inflammation, what we're talking about is bringing your system down to that rest and digest place, because when it's in that rest and digest place is where a lot of the restorative action happens, where a lot of the healing happens. Our systems are only designed to be in this fight or flight type situation for temporary spurts of time, and just the way we eat and the way we go to work all of the time, and the ideas behind some of our society of work, or all of these things, and not enough sleep, they all add up to your system always being in fight or flight mode, and your system being exhausted and needing stimulants like caffeine or sugar to keep you going. And that just keeps ramping everything up, just like keep ramping it up over and over and over again. So it really becomes a systemic inflammation problem. And so it shouldn't be a surprise then when your nerves are super ready to react to anything, right? Because that's what we've trained them to be. So when that happens, it's just a tipping effect at that point, like anything's going to tip it over into just incredible pain or a really bad nerve experience, right? So systemic inflammation is really important to bring down, and we can do that in a lot of different ways. And one of the most important ones is through nutrition. And a lot of the times it's because the things that we eat some of them are in our control, and some of them aren't. Obviously, we all know that like packaged goods and fried food and stuff like that, they're not the best for us. We've heard a lot about, how sugar can be really bad for you and stuff like that. And those are very, very true. And then, of course, there's the whole aspect of food allergies and or food sensitivities. And this is actually much more prevalent now than it ever has been. And a lot of the reason for that is because of the long-term exposure to things like pesticides that our system is experiencing. And what ends up happening is that these pesticides, our body doesn't recognize them and can't digest them. So when we eat them, they literally end up poking holes in our gut, which all of these things are now leaking out because there are holes in your gut, right? So this is called leaky gut syndrome. And for a simple way to explain it, like these things are starting to leak out from your gut that are partially digested, and instead of being just removed with toxins and in your waste, instead they are now in your bloodstream. And what ends up happening is your bloodstream, something targets it, your white blood cells target it and say, hey, you're an invader, you're not supposed to be here. And then everybody gets put on alert and saying, like, this guy's not supposed to be here, like, watch out for him, kick him out, kind of thing. And the problem is that some of these things end up looking a lot like what your system, like things that are supposed to be there in your system. And so when that happens, then your body starts attacking itself, and you see things like autoimmunity. So that's why when you see a lot of these autoimmune type conditions, they end up having food allergens related to it because of that. And then you're talking about people who are systemically inflamed, who have lots of sensitivities to everything, lots of allergies, smells give them headaches, all sorts of things like that. That's when your system's super inflamed. So our goal is to try and bring some of that down by possibly eliminating some of those food allergens, getting you adjusted as much as we can to, reducing sugar intake and stuff like that to help modify that. So then once the system calms down, the pain calms down with it because the nerves aren't constantly irritated. So I hope that clarifies a little bit. We definitely use nutrition a lot here at ISC, and it's going to be pretty important. We can muscle test specifically what nutrition works for you and what's important and why you need it. And then we can confirm those things with lab results and stuff like that, which is also super cool. But it's definitely a big part, and it also is important to your adjustment holding, because in a system that's super inflamed, your adjustment can't hold because things are just too wound up. So I hope that helps clarify some things. It's definitely an important topic and one of my favorite topics because it has such big effects, and you can really just change your life by deciding what you put in your mouth, and that's just incredible to me. Anyways, I hope that helps. Definitely ask us if you want to know a little bit more about nutrition or how it can help you, or do some muscle testing to find out. And I look forward to working with you guys. Thanks.